Welcome back, everyone, to Open Line. We have with us Dr. John Dunn. He is the state epidemiologist for the Tennessee Department of Health. He was with the governor today as the governor declared a state of emergency with the coronavirus. I ask a bunch of questions at the top of the show. Let's now go to our viewers. Let's go to Greg. Hello, Greg.
Hey.
Go right ahead. What's on your mind?
Hi. Well, from what I understand about this coronavirus is that it's not anything different than just a different strain of the flu. It's another strain of the flu. And the people that are actually dying from it are people that have really problems with their immune systems and they're weak, the elderly and senior citizens. Those are the people being affected. I just don't understand why this has turned into a big hysteria in this country, other than our government wants us to be forced vaccinated. And there's no way that this government will ever convince me that I need to be vaccinated for something I'm not going to catch. If I do catch it, it's just the flu. It's just a different strain of the flu. That's all it is. The media should be held accountable for all the stock market falling apart, all these people being afraid of dying from this thing. It's just a different strain of the flu. So I'm disgusted with the whole thing, and it's just appalling how much control the media controls people with fear. So,
all right, well, that's ridiculous. But let's what we have now is not the media, okay? What we have is the state epidemiologist. So let's listen to what he has to say. If you had heard my questions, you would have heard him answer much of that. But let's listen again. What do you say to what he just had to say?
Well, I think Greg's concerns are, a lot of people have those questions, and we talked about are things overhyped and so forth, and I could repeat my answer, but we think it's very serious. Anytime people's health is involved, that's a very serious thing. Just to clarify a few things that he said, it's not a strain of the flu. It's a respiratory virus, as flu is, but it's not the flu. It's a new disease that we don't know a lot about, and we've certainly seen big impacts in countries where it's been, spreading for months. And when it affects that many people, even if the death rate is low, you start to have a lot of hospitalizations and you start to have deaths. So that's very serious, and that's people's families and so forth. That we want to be responsive and try to address people's concerns and so forth, but it's something we need to take very seriously.
It's something we need to take seriously. Greg is saying, if I get it, it's just the flu, it's no big deal. What if Greg gets it? Greg is not an old guy, it doesn't sound like. Yeah. So is Greg going to be just fine, or do we know?
Well, we don't know. What we're learning about is that among younger groups, healthy groups, that it is a mild illness. I've seen estimates of 80 to 85% in some of the early data that those cases are mild. But one of the bigger concerns for us are older populations, people that are immune compromised. We've done a lot this week to reach out to long-term care facilities, to the developmentally disabled groups, a number of different groups that are in kind of contained populations that we would be concerned about. And we really want to focus on those groups because that seems to be where the highest death rate is. Emphasizing those things like hand washing, not allowing people into those facilities when they're sick. Our commissioner this week, Commissioner Piercy, gave a personal memo to every long-term care facility in the state to help them understand how serious it could be amongst that population. When I was driving to work this morning, I was talking to my mother on the phone. My mom and dad are in their mid-80s, and spoke with them and said, Mom and Dad, I don't want you to be overly concerned, but I do want you to take precautions. And if there are family gatherings where some of the grandkids might be sick, then don't come. While this is going on, like I said, we don't know how long it's going to last, but some of those types of precautions that we can take with our loved ones, our family members, with some of our older populations that are in those types of settings, that's what we're trying to do as the Tennessee Department of Health. And the governor mentioned that today. Our commissioners very focused on those populations. So it is serious. It does cause hospitalizations and deaths, and we're taking that to heart.
And it may, I mean, Greg may be a younger guy, but if he carries it and gives it to his parents or an older person, that can be a very serious situation. And that's part of what you're also concerned about.
That's right. And that's a question, with children too. Children might be able to carry the virus. So what the dynamics are of spread within the community, we're learning about. Hopefully we'll continue to learn more. Our recommendations will change with the information that we learn, and we'll be preventing more illness in the community.
Let's go to Maria. Hello, Maria.
Hi, thank you for taking my call. The reason that I'm calling is because I love the way they talk. They talk about washing your hands, don't get close to people, but they never mention God. How come they not mention God when in the Bible, Jehovah say, before he sent his son, he's going to be pestilencia, earthquake, disasters all over, and we see everything. Now we see a pestilencia, but they don't call him pestilencia, they call him the virus.
Okay, all right, so you, that's fine. She says we should mention God, certainly pray. I know a lot of churches are canceling service this Sunday. Do you think that's a smart thing to do? Some churches have older people there, but what do you say about that?
Yeah, I mean, again, it's we're trying to provide the best information we can to people that organize events, to places of faith, the SEC tournament. Those are local decisions that people need to make, and there's oftentimes multiple factors. So, we want to come alongside businesses, event planners, communities of faith, school districts, and provide the best information we can so that they can make that decision at the local level.
Let's go to Derek. Hello, Derek.
Yeah, hey, how you guys doing? Ben and the doctor. I have some issues, just not with the doctor, but with the leader of our country, President Trump. How can I believe you, doctor? You're on our local level, state level, rather. When we have a president who said last week would have 1 million available by the end of Sunday, now he said that we would have 4 million. And if you talk to Kaiser Permanente, if you check with the Mayo Clinic, if you check with all John Hopkins, they'll all tell you, where are they? And so we have misleading information. Just not on this, everything else that comes out of the White House is misleading. But how are we supposed to believe anymore? How do we know that Pinocchio is not lying again and crying wolf? And I think it's interesting that we're so much bigger than South Korea, but South Korea is able to do testing 12,000 to 15,000 people a day and have the capacity to do up to 20,000 tests a day. I think America has tried to insulate itself. It did contact the EU to let them know that we're going to stop flight. The European Union, people we're supposed to be allies with. That kind of stuff just shows me we have somebody in the White House.
Let's talk about the test. So he's upset with the federal response. He's upset with the president, who has said some things that don't add up. What about tests? South Korea is testing much more than we are. There's a great deal of frustration about the number of tests. How many tests have we done in Tennessee? This is saying 88 total tests completed. Is that right?
I believe that's the number for today.
Okay,
and that number is changing every day. I think one thing that people need to understand, or that we'd like for them to understand, is that, again, it's a brand new disease. The CDC developed the test and shipped it out, and our lab is trying to stand up the capacity while our normal system. So, Derek mentioned the timeline of how many tests are being done in South Korea. I don't really know that information. What I do know is that we've got the test at our labs working as quickly as we can.
But we don't have that many.
That's right. It is a limited amount. We've been able to test all the specimens we've received, so I think that's encouraging. And as I mentioned before, we're really glad. It's good news that the commercial labs are coming on board and that some large medical facilities are also doing testing now on their own. So that's going to increase our overall capacity. We've been kind of, as I said, standing in the gap, trying to get testing done and identify where cases are, might be occurring in Tennessee, and now as these new options come on board, we'll have a lot more testing capacity.
The commercial labs, that's private industry.
That's right.
And so you have Derek here who's saying, I believe, boy, we saw this coming. It's not like this was a surprise. It's been going on in China. Now it's moved over. Why do we not have more tests? Why does the government not have more tests ready? Has the Tennessee been frustrated that there are not more tests coming from the federal government?
Well, we have been seeing it coming, but I think it's interesting. One of the things that the governor said in this first press conference that I thought was really important was, we want people to have perspective, and it seems like for us, it seems like we've been in response mode for a long time. We've been working a lot on this, but it's actually been a relatively short amount of time since this has occurred at the end of last year, just a few months. So those types of tests are very complex. It takes time to develop, and I'm not surprised that the test took that long to get out. I do wish it had been faster. I wish we had more capacity sooner, but it's a step-by-step process. We have to be sure the test is correct. We don't want to falsely identify people. We don't want to not detect as well. So we have to be sure the test is correct. It has to be approved by FDA, and that's very, very important in terms of people getting the correct diagnosis and getting care if they need it.
With private industry, with these commercial labs, how many people do you think will be testing a day in the next week or a couple weeks? What do you think it will get up to?
Yeah, I mean, I'd have a hard time estimating what that is, and that's going to depend on the spread of the virus to some extent. We hope that practitioners that normally use, medical practitioners, doctors in the community and other healthcare providers, as this comes up, they're going to have access just like they would for other tests, and that it'll be a test that's easy to order and help them with their care of the patient.
So more tests are coming. All right, we're going to take a break. We'll be back right after this.